There's two different situations where we'll have a C-section. Of course, there's the scheduled one, and then there's our goal was to have a vaginal delivery, and sometimes things don't go as planned and we need to do a C-section. In the scheduled C-section, usually the mom comes in, dad, or other significant other, and they come in and we get them ready for the C-section. When they come in, put the baby on the monitor, give mom an IV. We usually give all our clients an antibiotic before they go into the operating room to help prevent infection of the wounds afterwards or in the uterus. And then if the mom, again, has not been a laboring mom, she goes into the operating room and the anesthesiologist puts a spinal in. That's what we use. The spinal anesthetic gives a very good complete block for mom for her C-section. And then once we test to make sure that she's fully numb, then we'll bring in whoever she prefers to have with her in the C-section. And then we do our C-section. Our pediatrician and their team are in the room at the same time. So once we deliver the baby through the C-section scar, we pass the baby right there, and it's all stay in the same room so mom can hear the baby cry, kind of get a glimpse of the baby. And once they've made sure everything is good, a lot of times they'll bring dad or whoever is along over to see the baby, and then both of them will come back around to mom too, so she has a chance to spend some time. It's slightly different if we have a laboring mom who winds up in the OR. There, a lot of times if she's had an epidural that's used for labor, that's not enough for a cesarean section. So the anesthesiologist will usually give more medicine through that epidural to make sure it gets her good and numb. Usually from the time we make the incision till the time the baby's born, it takes usually within 5 minutes. Sometimes it could take a few extra minutes if it's not the first C-section. A woman's had several C-sections before, there could be some scar tissue which can slow things down a little bit. But usually within that first 5 minutes or so, the baby is out. And once the baby is delivered, if she is feeling any discomfort, often our anesthesiologist can give her a little medication to help with that. Then usually from that point, within the next 30 minutes or so, we're completely done. When we close the incision, we use an absorbable suture and put a dressing on top of that, so there's not staples or stitches that have to come back and get taken out later. Come back to the room, usually pretty numb for a while, and for the first hour or so, completely numb. So usually before moms even try to get up, which can be a couple hours later, we always have them make sure they get help before you try to get out of bed, because it can feel like you're up and ready to go and the legs can be kind of wobbly. We'll usually keep the catheter in the bladder for the first 8 hours roughly, because it can be hard to get that sensation back. We have automatic pain medicine for the first 24 hours. So besides the anesthesia, the spinal, which can wear off in an hour or two, or the epidural the same way, there's automatic pain medicine we give over the first 24 hours, none of which impede breastfeeding. And then usually the following day, moms are feeling pretty good about getting up and getting around, but still can be kind of sore getting up and getting out of bed. I always tell them getting up and getting down is the hard part. Once you're up, you're okay. Once you're down, you're okay. From getting to point A to point B can be uncomfortable. And then there's pain medicine at that point that they can ask for on an as-needed basis. As far as who follows with the patient in the hospital, sometimes that could be a little bit variable. We do have 2 different offices, so sometimes we're not always in the office here in Warrenton, or the office in Lake Manassas, or if it's a weekend overlap, usually one of the other providers may wind up seeing the patient.